India has a low breast cancer survival rate of 66%. Breast cancer ranks as the #1 cancer among Indian females with a rate as high as 25.8 per 100,000 women. The major reason for the low survival rates of breast cancer in India is that awareness about cancer and its treatment is very low. Let us understand the types of breast cancer. They can be categorized into 2 types. Sporadic breast cancer, which can develop during the lifetime, and hereditary breast cancer, where mutations are present in DNA since birth. Let's get to know more about both types. Sporadic breast cancer. Sporadic breast cancers result from a stepwise accumulation of acquired and uncorrected mutations in somatic genes during lifetime because of a lot of reasons. It could be alcohol, smoking, work conditions, exposure to UV radiations. And hereditary breast cancer. Hereditary breast cancer is characterized by an inherited susceptibility from parents to breast cancer on basis of germline mutations in one or more genes, such as BRCA1, BRCA2, CHEK2, TP53, or PTN. Inactivation of the second allele of these tumor suppressive genes would be an early event in this oncogenic pathway. Type of tests for breast cancer. Let us first understand what is gene mutation. Gene mutation is a permanent alteration in the DNA sequence that makes up a gene, such that the sequence differs from what is found in most people. Compared to sporadic cancer, people with hereditary cancer have 20 times more risk of developing cancer, highest being breast, then colorectal, uterine, and ovarian cancer. For any ailment, tests are usually divided into 4 categories: screening, diagnostic, prognostic, and predictive. In this video, we're going to show you each and every type of test for breast cancer. And in the next video, we will provide all the details for these tests. The first category is screening. This is the category where most people fall into, and the tests that are part of the screening process are mammography screening and PET CT scan. The second category is diagnostic. This is the stage where one gets confirmation about the breast cancer and they help in starting of the treatment. The tests in this stage are histopathology, final diagnosis panel, ER, PR, HER2, NEU, Ki67. The third category is prognostic. The test in this stage helps identify risk stratification for the next 5 years and to help choose the right therapy for the patient. The test in this stage is CanAssist. The fourth category is predictive. This is a very important category as it identifies which drug works best in which patient. The tests in this stage are BRCA Drug Profiling Panel, N195, Cancer Targeted Panel, Breast, 52 Genes Focus Fusion Panel. Within the fourth category, there is yet another test, which is BRCA1 and 2 Comprehensive Mutation Panel, whose test code is N194. This test is for people who are healthy and currently don't have cancer. These people are at high risk of developing breast, ovarian in females, and prostate cancer in males in the future because of the family history of multiple cancers. The risk stratification by BRCA1 and 2 Comprehensive Panel or OncoPro Hereditary Cancer 98 Genes Panel can be done at this stage.
Screening. Breast cancer screening through mammography. Mammography screening is a low-dose X-ray examination of a woman's breasts used to detect breast cancer when that cancer is too small to be felt as a lump. The aim of screening mammography is to reduce the death rate from breast cancer by detecting unsuspected breast cancers at an early stage. The screening can be started as early as 40 years, once in a year. At the age of 55 plus, continue to have regular mammograms for as long as you are in good health. Breast cancer diagnosis through histopathology final diagnosis panel Z707. IHC or immunohistochemistry is a special staining process performed on fresh or frozen breast cancer tissue removed during biopsy. The panel gives histopathology included in it, along with an unlimited set of IHC markers to arrive at the final diagnosis: size, stage, grade, lymph nodes, 0, 1, 2, 3, 4. The clinical specifications of the panel are: establishes exact and final diagnosis by utilizing unlimited number of lineage differentiation, lineage-specific, and cell-specific markers to arrive at final diagnosis. Each case is reviewed and signed by 2 subject matter experts. The digitized images of the slides are provided in the report. The markers are performed along with the final diagnosis panel or post that to take the therapy decisions. Hormone status: ER, PR, HER2, NEU. HER2 status: scoring 1, 2, 3. Along with diagnostic test histopathology final diagnosis panel, ER, PR and HER2 NEU testing is recommended for every breast cancer. If the patient is positive for estrogen or progesterone receptor, she can be treated with hormonal therapy. Hormone therapy is often used after surgery as adjuvant therapy to help reduce the risk of the cancer coming back. HER2 NEU testing by IHC. The IHC test gives a score of 0 to 3 plus that measures the amount of HER2 receptor protein on the surface of cells in a breast cancer tissue sample. If the score is 0 to +1, it's called HER2 negative. If the score is 2 plus, it's called borderline or equivocal, and it has to further confirm by FISH testing, which has a separate test code. A score of 3 plus is called HER2 positive and may get benefit from targeted therapy called Herceptin. Rastazumab. Higher Ki-67 index tumors showed more HER2 NEU overexpression, larger size, and more lymph node involvement compared with other types and may be considered aggressive. Predictive. BRCA1 and BRCA2 genes. Think of what happens when their function is compromised. Both genes are tumor suppressor genes. A mutated BRCA forms a defective protein which is unable to help fix DNA damage, leading to mutations in other genes. These mutations can accumulate and may allow cells to grow and divide uncontrollably to form a tumor. The genes that are responsible for hereditary breast cancers are increased 2,600 mutations, including insertions or deletions. BRCA1, chromosome 17. BRCA2, chromosome 13. There are 2 test codes for BRCA testing. N194, BRCA1 and BRCA2 mutation advanced panel for germline testing on blood for breast, ovarian and prostate cancer. N195, BRCA1 and BRCA2 mutation drug profiling panel for both germline and somatic testing on tissue for breast, ovarian and prostate cancer. When to do BRCA testing? The FDA-approved olaparib, Lynparza, for the treatment of patients with germline BRCA positive, HER2 negative metastatic breast cancer who have previously received chemotherapy. In a cancer patient, PARP inhibitors stop the PARP from doing its repair work in cancer cells and the cell dies. They focused on cancers with a change of fault in genes called BRCA. The clinical USPs and BRA platform are ion torrent assay from Thermo Fisher Scientific to detect BRCA somatic and germline mutation from formalin-fixed paraffin-embedded tissue and whole blood. The assay can detect large indels and whole gene deletion and duplication events. 100% exonic coverage with large intronic flanking regions, uniquely empowering to detect all classes of mutations in one NGS workflow, removing the need to employ multiple technologies. Combined with a tailored bioinformatics solution using Ion Reporter software, enables detection of all relevant variant types with high confidence. CanAssist Breast. CanAssist Breast morphometric IHC-based risk prediction test. As per recent NCCN guidelines, multi-gene testing for risk stratification is mandatory in early-stage breast cancer patients before deciding the patient on chemotherapy. At this, CanAssist Breast test fits very well as it is validated in Indian population, unlike other tests like MammoPrint and Oncotype DX. It is a morphometric IHC-based test, provides CanAssist Breast score as low and high risk in early-stage breast cancer patients, stage 1, 2 and 3A, with the expression of 5 novel biomarkers and 3 clinical parameters: tumor size, grade, and nodal status for distant recurrence over 5 years. The test is cost-effective, predictive, and reliable to assess risk of recurrence to plan optical treatment for targeted drugs, hormonal versus chemo. IHC biomarkers CD44, N-cathedrin, pan-cathedrin, ABCC4, ABCC11. The inclusion criterion for the test are patients with invasive ductal carcinoma of the breast, stage 1, 2 and 3A, block with 30% tumor cells. Any of the hormones should be positive, ER, PR, estrogen, progesterone, HER2, NEU receptor negative, HER2 negative, up to T3 tumor size, node negative and positive, up to 3 nodes. The USPs over other tests available in the market. The test is validated on 1,400 Indian patients, accredited by ISO 13485 certification, CEIVD, and ISO 15189 NABL, published and presented the data at major international conferences, including Co-BRCA 2016, ESMO 2017, ESMO 2017, SABCS 2017, SABCS 2017, ACS 2018, etc. The test has 100% actionable results with clear stratification as low and high risk. Better prognostic ability compared with Ki67, PREDICT, IHC4, etc. Has 80% concordance with Oncotype DX. Cost-effective, unlike other tests, MammoPrint and Oncotype DX.